episode 58 of the Real World Paleo Podcast. Hi everyone, I'm Christine Lehman, a nutritional therapy practitioner and reverse diabetes coach, which is also the name of my website. I help clients reverse diabetes naturally, lose weight, and lower their cholesterol. I also see clients by Skype. I want to tell you about a very exciting nutrition class, my online Eat Well class that starts this Tuesday, October 18th at 8 p.m. Eastern Time. You can learn more about the class on my website at reversediabetescoach.com/eatwell, all one word, -class. And I'll give you the link to the class at the end of the podcast today, as well as put it in the show notes. Please remember while you're listening to the show, advice and information we provide is intended to be helpful and informative, but is not a substitute for medical advice or treatment. I want to welcome back my frequent co-host, Amy Berger, who is a certified nutrition specialist and a nutritional therapy practitioner. So we're going to talk today about the topic of resistant starch, which has been featured in the blogosphere and various studies. So welcome, Amy.
Hey, Christine. How's it going?
Pretty good. How are you?
I'm good. It's a little bit overcast today after some beautiful fall days, but I'm glad the summer heat is gone. That is for sure.
Yes, me too. I don't think I really realize how bad it is until we hit fall.
Yeah, honestly, I've never been a hot weather person. The only thing I really like about summer is the farmers markets, and they run all year long, but the produce is just there's so much in the summer.
Oh yeah, it's fantastic. I love the farmers market. So let's get into resistant starch. First, I always like to define things, so I thought I would just introduce the topic. It is a prebiotic, which is an indigestible carb that reaches the colon intact and selectively feeds many strains of beneficial bacteria. It's actually one of 3 prebiotics. The other 2 are non-starch polysaccharides, such as inulin and fructooligosaccharides, a little hard to pronounce, and soluble
I think it's on a lot of food labels they abbreviate it FOS, the fructooligosacchαρide, yeah.
Yeah, exactly. And then soluble fiber, which I've taken, such as psyllium husk and acacia fibers. Excuse me. So resistant starch, really the concept there is it resists digestion. And once resistant starch reaches the large intestine through your digestive process, bacteria attach to it and digest or ferment the starch. And that is the mechanism through which we receive many benefits of resistant starch, which we'll talk about more in a minute. So there are 4 types, which I thought I would run through. There's the first type, which is a starch that is physically inaccessible. So it's bound within your fibrous cell. It's bound within the fibrous cell walls of plants. And so not surprisingly, it's found in plant sources of food, such as grains, seeds, and legumes. And we'll talk about how, if you go that route, you might want to prepare them. The second type, which is probably a little bit more commonly used, could be, which is starch that contains a high amylose content. So that means it's indigestible in the raw state, and which may set it apart. This is found in potatoes, green unripe bananas, and plantains. And Amy, I know you've written more about plantains, and we can talk about that. What's interesting about this one is cooking these foods causes changes in the starch, making it digestible to us, and that actually can remove, the resistant starch. So that's another point we'll elaborate on in a little while. Then there's type 3, which is also called retrograde resistant starch, since this type of resistance forms after either the first 2 types, which I've talked about, are cooked and then cooled. So these cooked and cooled foods can be reheated at low temperatures, but a key point here is that when you do reheat it, you want it to be less than 130 degrees in order to maintain the benefits of resistant starch. Because if you heat it at a higher temperature, that will convert the starch back into a form that's digestible to us. So then you lose some of the feeding gut bacteria. And examples include cooked and cooled parboiled rice, cooked and cooled potatoes, and if properly prepared, and that's soaked and sprouted legumes that are cooked and cooled. Now, the fourth type of resistant starch is a synthetic form, and the key word there is synthetic, which should give you a hint that we're probably not going to recommend that. So an example would be high maize resistant, that's MAIZE, resistant starch. So we, again, don't really recommend synthetic forms. So now we're going to get a little bit into the science, which I think we always find interesting. So it begs the question, how does resistant starch work? What are the mechanisms? And if you think about there's been a lot of talk, Amy, as you know, about the microbiome, which is really, the human gut. And it's loaded with bacterial strains, lots and lots of them. And listeners, you've probably heard that expression, good and bad bacteria. So one of the key points here is you want to maintain a healthy balance between your good and bad bacteria. And we're really oversimplifying when we use that terms good and bad, but we'll go with that for now. So what do we mean by balance? We're really talking about the overall number and then the relative quantity of each type. And that's what's critical to maintaining our gut health, and then, of course, that impacts our overall well-being. So before I launch into this, Amy, is there anything else you want to add at this point?
No, I think just going forward, when people hear us talking about the gut biome, I think we just need to keep things in perspective, because I'm not doubting the importance of the makeup of the microbes in the gut, but I think there's not really any definitive evidence yet as to what is a quote-unquote optimal, bacterial makeup, and is it the cart or the horse? Is the makeup of the biome driving the health or driving people's weight, or is the biome the result of what people are eating? And so there's a lot of unanswered questions. I think the biome is a huge area of research, and that research is being done, but I think there are some people in the paleo world and the ancestral health world that I think are maybe getting a little ahead of things, because we just there's so much more we don't know than what we do know, I guess is what I'm saying.
Right. No, I think you raised some interesting points. One is the science is evolving. And so maybe we're not at a point where we want to draw any kind of definitive conclusions.
Yeah, I mean it's interesting stuff, and we need to talk about it. But right. We just don't know. We're in the infancy, which is kind of interesting because it could really go anywhere.
Right.
And are we there? Dr. Michael Ruscio gave a talk at the Ancestral Health Symposium just this year. I think we're going to include that link in the show notes. But he had a very good talk about what kind of biome do we want, and do we even know? And that's really worth watching for anyone out there who's interested in this topic. It's really fascinating.
Mm-hmm. Yeah, I think he spoke too at the Paleo Effects, and is very knowledgeable. So yeah, I think that chicken and the egg question is something that and sometimes it is complex, and so. That whole interplay, what's driving what here, is fascinating. So back to my science primer. Resistant starch can help maintain that balance that I was describing between, quote-unquote, the good and bad bacteria by selectively stimulating the good bacteria in our intestines. So these good bacteria feed on the resistant starch, and they produce short-chain fatty acids through fermentation. The most significant, of which there are three, and they are acetate, butyrate, and propionate. But of these three short-chain fatty acids, butyrate has the most beneficial effects on the colon. In fact, it serves as an energy source of cells lining the colon, and it also can improve overall health in terms of increasing your metabolism and decreasing inflammation, which is all good. So the good news and significant point is that resistant starch appears to increase butyrate production more than other soluble fibers. So what are some of the health benefits here? Well, the first one we'll talk about is resistant starch seems to help lower blood glucose levels and improve insulin sensitivity. And you see insulin resistance and chronically elevated blood glucose in a whole sort of trajectory or pathway of syndromes and chronic conditions, from metabolic syndrome to prediabetes and type 2 diabetes, and this may also be evident in polycystic ovarian syndrome and some other related conditions. So several studies have shown that resistant starch can improve insulin sensitivity and decrease blood glucose levels in response to meals. So we talk about postprandial blood glucose, and that just means basically how you're responding to a meal afterwards, after you've eaten, typically 2 hours afterwards. So in one study, consuming between 15 and 30 grams per day of resistant starch showed improved insulin sensitivity in overweight and obese men. And that was equivalent to the improvement that you would expect to see with weight loss, and approximately a 10% body weight loss. And I thought that was interesting because that's comparable to some studies that I've seen, longitudinal studies, using, with diabetes programs and diet. I can't, pinpoint the specific one that they were using. It was not paleo necessarily, but that's a typical amount of people that they recommend that you lose between 5 and 10% in order to see a reduction in your blood sugar levels. And then there's also what they call a second meal effect. So that would mean that not only does resistant starch decrease the blood glucose response at the time that the meal's consumed, but it could even show up the following meal. So I thought that was an interesting tidbit. And then some of the other benefits are weight loss, as I mentioned briefly. But it's really not just the weight loss itself. It's the other factors that contribute to weight loss, such as decreased blood insulin spikes after meals, decreased appetite, and decreased fat storage in cells. And then there may also be more of a preservation of lean body mass, although more research in humans needed to be done to confirm that. And then we also talked about how resistant starch impacts increased production of butyrate by our gut microbes, and by acting as a powerful anti-inflammatory agent for the colonic cells, butyrate also which butyrate does, it also improves the integrity of our gut by decreasing intestinal permeability. If you've heard of leaky gut syndrome, that's a big problem and contributor to that is your intestinal permeability. And then also keeping toxins in the gut and out of the bloodstream. So those are some of the many benefits that the research is showing promise. And then it's also, just to wrap that part up, it's also associated with decreased risk of colorectal cancer. And I think that's mainly it. We've talked about anti-inflammation. So, Amy, do you want to talk more about what I know you've done a fair amount of research on this. What do you think of these benefits and findings?
The blood sugar regulation stuff is so fascinating to me because I'm going to admit straight up, I don't understand how this works. It works, but I don't know how. And a lot of these studies, unfortunately, don't really say a lot about the mechanism.
Right.
They just kind of say, or at least the studies I had the full text to, a lot of them are only the abstract, but they say we gave these particular types of subjects this amount of resistant starch, and here's what happened to their insulin, here's what happened to their glucose, their weight, triglycerides, whatever. What I would like to see, because here's the thing, in one of these studies, I'm looking at the abstract right now, they gave resistant starch, let's see, I don't know if they say the source of the resistant starch. Mm-hmm. It just says resistant starch. But the meal it was added to, they had 10 normal weight subjects and 10 overweight. And they were all women. So 10 women with a BMI average 30. And the meal they added the resistant starch to was a muffin of 60 grams of carbohydrate. And this article is from Diabetes Care magazine, so go figure, big shock, what a surprise that they're giving these subjects a 60-gram carbohydrate muffin. And what I don't see in a lot of these studies, this is just one example, what I don't see is anybody testing resistant starch on people already following a low-carb diet. I guess what I think is for the purpose of blood glucose control and maybe small reductions in insulin, this could be a great little hack, and I hate that word, but I'm going to use it. This could be a great little hack for people that have trouble controlling their carbohydrate intake, but they really have blood sugar problems. I don't know that resistant starch is going to do a whole lot for somebody who's not eating this stuff in the first place. Mm-hmm. I don't think that somebody whose blood glucose and insulin is already normal needs this. Maybe there are the other benefits like the fermentation in the gut and the butyric acid, but in terms of blood glucose control, I would want to see them do some studies in people that eat a paleo diet or a low-carb or ketogenic diet, because it could be completely different from people eating 60 to 70 grams per meal, if not more. So yeah, you're raising an interesting point, because, the articles that I've been reading don't really make that distinct. They do bring up a low-carb diet, but just in terms of, how you would implement this. You can add it to your diet without adding digestible carbs. Right. What you're pointing out is that it's not being done necessarily on people already on a low-carb diet. Right. I guess I'm feeling like I wouldn't add this just for fun, like just, hey, let me add this. Like I just think I would add it for a specific reason. Like my whole question is why? Why add this? But, there may be reasons. But in some of these other studies, I'm looking at some of these other abstracts, and there may be some reduction in glucose and insulin area under the curve, which is basically like the total amount secreted over a certain period of time. And that's important, except some of these p-values, like the statistical significance here is not that great. And so some of it may have what they call statistical significance, but not a clinical relevance, meaning it moves the data point a tiny bit on the chart or the graph so these people can get the paper published. But what does that actually translate to in a human being eating real food in the real world, and not, rats in laboratories, not human subjects that are eating a very specific meal that's been provided for them. That's true of any study, though, not just resistant starch. We could say that about any nutrition study. They're constantly saying, a significant amount of XYZ, but statistical significance doesn't mean a whole lot. What we want to know is, does this actually mean anything in the clinical setting, like in a real person? Like, is this relevant, really? Right, and I think that raises, we're talking about methodology here, and, the two things. One, have there been enough human studies done? And then the second piece, there's a range of statistical significance, and, so as you were pointing out, the p-values may be fairly low, but the bottom line is to how well does this translate into human beings. Yeah, and I do think it does translate. There are human studies, and there's a lot of, the word anecdata. There's a lot of anecdotes out there from people that have used this, that measure their blood glucose, that have seen decreases. So it is effective, but I think we should be careful in how much we attribute to this. Absolutely. I agree with that. So, okay, so do you want to talk about implementation? Sure. Let me find my notes. I wrote all over everything here. So obviously, we would generally want people to do this with real food if they want to play around with resistant starch. So some of the foods that you could eat are green bananas, so you want the unripe bananas. You could do plantains, and unripe plantains are better also, so the green ones as opposed to the yellow or the brown. You could do rice. They generally say white rice. I would assume brown has the same, but I'm not sure. You would cook it and let it cool, and you would eat it when it's cool. And the same thing with potatoes. You could boil or bake some potatoes and then let them cool and eat them, which is really interesting because if you make a potato salad or like a bean salad, like a 3-bean salad with some onions and, other vegetables in there, normally those dishes are made with some kind of vinegar, which is really interesting, especially if you're going for the blood sugar control angle, because vinegar has some really, really interesting properties when it comes to helping mitigate blood glucose and insulin after a meal, even after very high starch meals. So that's, if somebody is wanting to eat potatoes or beans, that's not a bad way to go. Well, I still don't know that I would recommend it for a diabetic, but, if you want to have potatoes or beans, let them cool and have them with vinegar. That's a pretty good way to go. And in terms of the beans, there was one study that published the glycemic index and the resistant starch content of a whole bunch of different foods. They had rice, millet, wheat bread, muesli, cornflakes, potatoes, beans, and the number one food that I can see on here, and number one meaning it has the highest resistant starch and the lowest glycemic index, is lentils. And I would say that for anyone wanting to introduce this kind of stuff, compared to grains and even compared to potatoes, beans seem to have a little more resistant starch and a far lower glycemic impact. And so the lentils were the best, but chickpeas look pretty good, kidney beans look good. The other one just says baked. It doesn't specify what kind, but and I've noticed, I don't test my blood sugar very often anymore, but back when I used to, I did notice that lentils really didn't do a whole lot. They didn't spike me too much, and potatoes too. And I didn't eat them by themselves, eating them in the context of a meal with protein and with fat. But I remember being surprised at how normal my blood sugar was. I mean, it was 2 hours after the meal, but I had a bunch of potatoes, and it was fine. So I think that's one way to do it. And for the people that don't want to add these starchy foods, they could use purified resistant starch, which one of the more popular ones that people have used is Bob's Red Mill unmodified potato starch. And it's not potato flour, it's potato starch, but they still sell it. You can get just a bag of it. And you can add it to anything. I think you can add it to cold liquids, cold foods. You can add them to room temperature stuff. You wouldn't really want to heat it that much because the whole point is that the heat kind of destroys the beneficial properties of it.
Right.
But you could add it to a smoothie. You could add it to almond milk. You could probably add it to soup. So, and there's people... The people that have played around with this, for the most part, I think, have done the potato starch. A lot of them haven't done the food forms.
Mm-hmm. Yeah, I think you're right. It's probably easier than going through this heating and cooling and process, because you can buy it, like you said, in the store. And so it's just probably a bit more convenient.
Yeah, or I mean, some people will, you could get get a bag of potatoes and boil a bunch of them and keep them in the fridge, because then they're ready to go. You wouldn't want to have to.
Right, so that was one of my questions, was when they talk about cooling, do they mean refrigerate or at room temperature?
That's a good question. I don't know if that was addressed in any of the studies. I know it would be okay out of the fridge. I'm not sure, just maybe like at room temperature, like if you boil a potato and just let it kind of cool off. It probably needs to be, actually I should say, I think it does need to be kind of cold, or not cold, but it shouldn't be warm to the touch, because there's something about the starch actually kind of gelatinizing. Mm-hmm. Oh, wait, no, that's I'm looking at my plantain research. The cooking causes it to gelatinize and become digestible, which is what we don't want. We don't want it to be digestible. I think it has to be cold. I mean, I don't know if you've ever had cold boiled potatoes, but they are kind of, I mean, it's a bad word because it's not very descriptive, but they're starchy. They seem starchier than hot potatoes, and I feel like maybe that's actually some of these compounds coming out or coming to the surface. I'm not really sure, but I would imagine there's probably more resistant starch in these things when they're actually cold than if they're still warm to the touch from the cooking process.
Mm-hmm. And then I think the other sort of question is, how much? Can you just make a recipe like cold potato salad, or do you need to do it in a more programmed, incremental kind of way?
Well, it probably depends on how much resistant starch you're going for. So like the chart in one of these studies says per 100 grams of the food, for example, white potatoes have 1.3 grams of resistant starch. And like the lentils, per 100 grams worth of lentils, it has 3.4 grams of resistant starch. And they do say to start really, really slow. Like if you're going to introduce this, especially with the purified potato starch, I think it was Chris Kresser who recommended that you start with about a quarter teaspoon a day, which is really tiny.
Yeah, it is.
So it's, it's not like, but it may be that when you're eating the whole food, it's more manageable by the body too than just the isolated form of it. But there was one study that compared different amounts of resistant starch in relation to some of the blood glucose issues. And they looked at, the blood glucose, fat oxidation, and respiratory quotient. And respiratory quotient is kind of a measure of the fat oxidation. So the closer to 1.0 your respiratory quotient is, the more of your energy is being obtained from carbohydrate. So like somebody on a very high fat, very low carb diet, like a strict ketogenic diet, is going to have a relatively low respiratory quotient, while somebody on a high carb diet, their RQ is going to be closer to 1. So this study said that as a percentage of the total carbohydrate, 5.4% as resistant starch was actually more effective than 10.7% as resistant starch. So it's not necessarily like a dose-response relationship or a linear relationship where the more you eat, the greater the effect. And there's not really any data on why that is. Like, does it start becoming harmful at a certain point, or is it just, there's a threshold where beyond the threshold, it may not be harmful, but it's not helping you any more than the lower dose was. So I don't think anyone needs to go crazy on this, but we do have to acknowledge that so many of the long-lived cultures of the world do eat legumes, they do eat rice, and they're probably not always eating it piping hot. So it wouldn't surprise me if some of these foods are beneficial in some way.
Yeah, there's what they call the blue zone research.
Right, exactly.
And I had someone on the podcast talking about that recently. It was actually Dr. Akil, who wrote Paleovedic Diet, but he, in his book, incorporated that. And that was fascinating because they're not all on a paleo diet by any means.
Right.
But they're commonalities across the different groups, including, of course, healthy fats and different forms of, starch.
Yeah, because, that's the thing. If we talk about some of these beans or some of these potatoes and even rice, they are still what I would call real whole foods, and they do have nutrients. We're not talking about Frosted Flakes. We're not talking about bagels. We're talking about foods that are still relatively whole, unprocessed foods.
Right.
And I think these foods have unfortunately become a little bit demonized, and there are people that are better off avoiding them, but that doesn't hold for everybody on the whole planet. And so
right, absolutely.
There's nuance there, but we should talk too about if people want to try this, it's not just using go slow is the main thing. Use a small amount, take time, increase it gradually. Don't double it like overnight. Because if your gut is not used to this, you will experience some bloating, some gas, cramping. You could have diarrhea or constipation. It may depend on the current makeup of your gut, whether it goes too much or too little. Because that's the whole point of this, right? The whole point is to provide bacteria in the colon with something to eat. And when they feed on this stuff that the human doesn't digest, but these microbes digest, the result is gas. They produce gas by fermenting these substances.
Right, and that's a common, reaction. And so, I was thinking, just to touch briefly on legumes, one of the reasons why we encourage that people do the properly soaked and sprouted if you have time is because it removes, phytic acid. That's usually the justification, but there's ways, again, if you just soak and sprout it or even soak them overnight, you remove a large percentage of that. So I think that's the only caveat with that. And if you tolerate it well, then, which is what we're talking about now, but you might experience, it sounds like, some initial gas and bloating and what you were saying. So
yeah, it does wane over time, though. Once your body adjusts to it, those symptoms should dissipate. But it's interesting, we mentioned that Dr. Ruscio video with there's so much more we don't know than we do know about the gut. And the thing is, it's so interesting to me because obviously this is helpful for some people. Some people take the prebiotics and they take probiotics and they're like new people. They feel completely different in a good way. But there are other people that benefit from what's called a low residue diet, meaning very low fiber, very low fermentable items, because it just aggravates their symptoms. It makes everything worse, whether it's digestive symptoms or some people get a lot of psychological symptoms when their gut is not right. It could be anxiety. It could be depression, all kinds of things. And some people, especially the people with things like the FODMAP sensitivity or just really bad digestive issues, seem to do better on very low fiber diets. And I don't think that's odd. That doesn't surprise me, but I would wonder, is that because they have some type of really severe dysbiosis and maybe the resistant starch would help that? And they may feel worse in the short term, but over the long term, as their gut kind of repopulates with different types of bacteria, maybe sometime down the line they would tolerate a lot more vegetables that they don't now.
Right, because when I was talking about the benefits in some of the research, it shows that butyrate, I think in particular, acts as an anti-inflammatory agent. So, I could see where that would help your gut, right? Because these conditions that we're talking about are, have often, have an inflammation as the basis for the problem. So if that were to help clear that up, which it sounds like a butyrate in particular could, I could see where that would be helpful in the long run.
Yeah, and the butyrate is interesting. I was reading some stuff from Mark Sisson on resistant starch, and he said it's mostly anecdotes, but I believe anecdotes. If somebody tells me that they felt something happen, I believe them. I don't consider it scientific data, but it's worth paying attention to. Right. So he said there are a lot of anecdotes, including from himself when he experimented with this. I think he did it mostly with potato starch. He said he had more vivid dreams, better sleep, and he felt more mentally calm. And he speculated that it was increased GABA from the butyrate. So for the listeners out there, GABA is gamma-aminobutyric acid. So that's the butyrate, the butyric acid, could make more GABA, which is a calming neurotransmitter. So like a lot of people that have anxiety or for trouble sleeping, insomnia, a lot of people will take GABA. And he also said maybe the resistant starch could be feeding some of the bacteria that produce serotonin. Because we think, oh, serotonin, you kind of automatically think, oh, that's the brain, happy chemical, the feel-good chemical. But most of the serotonin in the body actually is produced in the gut. Mm-hmm. So that could be a mechanism that if some of this resistant starch is feeding those bacteria, that it's making more serotonin, and higher serotonin maybe could give you more melatonin, which will help you sleep better.
Mm-hmm. Yeah, so there's a whole potential ripple effect.
Yeah. This whole resistant starch thing was huge a while back in the paleo community. Everybody was playing around with it. You don't hear as much about it now, and I don't know if that's because it was just a fad thing that people don't do anymore, or it's just not as exciting. They feel like been there, done that. So I don't really know if people found benefit good enough to keep going with this or not.
Mm-hmm. Yeah, I'd like to ask Mark Sisson if he's still doing it.
And they make plantain flour, too. We talked about the unripe plantains. I think they actually sell plantain flour, which would just be, dehydrated raw plantains.
Mm-hmm. Mm-hmm.
And I think, Diane Sanfilippo on her 21-day sugar detox programs, bananas are allowed, but they have to be unripe. They have to be green, and
green
it's probably... Yeah, probably because of this. Not specifically because of the resistant starch, but because of the less ripe it is, the more starchy it is versus sugary as it ripens. Yeah, and same thing with plantains. As they ripen, more of the starch gets converted into sugar.
Mm-hmm.
So, if people with blood sugar issues really like their bananas, or they really want something starchy, probably a green banana or a green plantain is not too bad a choice. Certainly better than, a donut.
Absolutely. Right, because you're going to get some of these, nutrients in there. And then I was reading potato starch can even be well tolerated by those who have problems with nightshades.
Oh, okay. Oh, that's good to know.
Mm-hmm.
That's really good to know, actually. What is your thought? Do you have any speculation as to that second meal effect? Because I'm fascinated by that. I just don't know what would be causing that, but it's interesting.
Yeah, I think I would have to go back and look at the studies a little bit more. How many hours are we talking about? Because postprandial, is 2 hours after a meal. So are we talking, what's the window?
Right, no, that's a good point.
Yeah.
And also, something else that we haven't talked about, there's a study out of the Journal of Nutrition from 2011 that emphasizes the individual variability. And that's, you and I have talked about that on previous shows in terms of glycemic impact of certain foods, how people really vary in their response. And it looks to be the same with this resistant starch, where, so one of these studies says overall acetate, butyrate, and total short-chain fatty acid concentrations were higher when participants consumed resistant starch, but individual responses varied. So it's like it's going to increase those short-chain fatty acids in everybody, but the degree to which it does will vary. So some people will probably have a big effect and some people won't. And that probably also affects how gassy are you going to get when you start introducing these things.
Mm-hmm. Exactly. And that, just in general, like legumes, I don't tolerate beans very well. And I've had, experience where people have cooked them and I've eaten them only to experience the after effects, even when I've traveled. So I've kind of learned the hard way to kind of stay away, especially if I'm traveling from certain things. But what's interesting, too, is Chris Kresser, I guess the other just point I was going to make is the way you're introducing it is very similar, I think, to like an AIP protocol. When you're actually reintroducing foods, you're using about the same measurement, a quarter or a half a teaspoon. So in that sense, it's this whole incremental approach. So it makes sense, monitor your, and I think going back to individuality, it's very individual about how much you can tolerate. I don't have a huge tolerance level for this kind of stuff. So, so I think that's where everybody has to kind of decide for themselves how much do you want to put up with. And then he recommends that you stop for a few days, similar to the AIP protocol, until your symptoms, if you're having, symptoms until they resolve, and then you can try again if you want,
Mm-hmm.
So it's kind of, a dose, if you will, of it. And then, in terms of the benefits, you may not even see them until you consume around 15 to 30 grams daily, which is 2 to 4 tablespoons. So,
yeah.
So that's another trade-off. If you don't reach that amount, is it worth pursuing?
Yeah, I mean, that's a lot.
That is a lot. Yeah.
And I guess I just don't know. It depends on what people are looking for, because I wouldn't use this as part of, let's say, a blood sugar control protocol. I mean, I would absolutely not say, I wouldn't consider potato starch a supplement. Mm-hmm. Other people might, but I mean, this would not be my first place to start. If somebody's having really severe issues.
Absolutely. I think there's so many other ways to, first of all, you want to decrease, their sugar consumption and processed food and move them into a whole foods diet. And that's where
mm-hmm.
most people are starting from. And then, and then you can, you're trying to clean up their gut, and often that just, a lot of those things resolve when you get on a whole foods, even medium, and we've talked about, again, depending on what they're already doing, how much, medium to low carb, there's a range there. But
mm-hmm.
I think the whole emphasis needs to be on healthy and whole foods in the beginning, and that can be, a good balance. There's protein in plant sources, so balancing animal and plant proteins as well. And then getting, that's the distinction I make. It's healthy carbs, coming from vegetables and fruit, mm-hmm. as opposed to all this, the refined carbs.
Yeah. And that's why I would recommend beans or not recommend beans, but among the foods that are a little bit starchier but that are still whole foods, I do think beans are kind of a better choice, specifically lentils. I mean, I've done a little bit of research on lentils, and lentils really seem to be fairly benign when it comes to blood glucose. I mean, not for everybody. Some people will be more sensitive than others, but compared to, let's say, black beans or lima beans, lentils have more fiber. They're actually a little bit more nutritious. Mm-hmm. And Dr. Jason Fung, who I don't know if the listeners are familiar with him, but he's up in Canada, and he's a nephrologist. He's a kidney specialist, so he gets a lot of very severely ill diabetic patients. And he does a lot with low-carb diets. He does a lot with fasting, but he also, I wouldn't say he necessarily recommends beans, but he talks about beans as being one of the less harmful carbohydrates because they have so much fiber.
Right.
And the fiber really helps blunt that insulin and glucose impact. Mm-hmm. And so I guess I'll just kind of reiterate what I said earlier. Like, if somebody really wants some potatoes or some beans, probably a good cold potato salad or bean salad, especially with some vinegar. That's like a double way to reduce that impact.
Mm-hmm. Yeah, that's a great suggestion.
And they're delicious, too. I mean, look, I'm a low-carber, but I love a good bean salad. I haven't had one in years, but they're delicious.
Mm-hmm. Yeah, absolutely. And I have clients from the Middle East, and, they're used to their hummus or their, chickpeas often comes up, or, and lentils. And that's, of course, part of the Mediterranean diet as well. So,
and the chickpeas on this list from the study that had the amount of resistant starch, per 100 grams of chickpeas, they're a glycemic index of 36, which is not that bad. I mean, compared to the foods that we eat or that we normally eat, it's high. But Kellogg's All Bran is 51, cornflakes is 80. So at 36, chickpeas is relatively low, and they have 2.6 grams of resistant starch, which is one of the higher items on the list.
Mm-hmm.
So like lentils and chickpeas both are good choices within this category.
Yeah. Yeah, and the other thing that in Chris Krusser's post, which I'll include in the show notes, but he points out that if you have marked GI distress with even small amounts of resistant starch, that may be an indication of small intestinal bacterial overgrowth known as Debo. So then he recommends, working with a healthcare practitioner to or establish a more balanced gut microbiome through other ways, probiotics as well. So before getting into the more prebiotics. So that's another kind of twist on this whole issue.
Mm-hmm.
So I want to thank you so much again for co-hosting today, Amy.
Yeah, no problem. Love to do it.
And listeners, I'll provide more links to resources that we've talked about in the show notes. Next episode, I will interview yoga instructor and practitioner Phyllis Haney about the Eastern history and philosophy of yoga, the different types of yoga, such as hatha and vinyasa, and how to get started. And don't forget to check out and register for my new online Eat Well class. Again, the link for that is reversediabetescoach.com/eatwell-class. So be well, everyone. Eat healthy and enjoy your week.